Good evening, last evening of the month, 9:31 p.m. Eastern Standard Time on Thursday, August 31st, year 2023. I'm your host, Mark Kulak, KULACZ. On show Houstonic.live. You can go to Houstonic.live to get the videos. I need to update the highlighted video. But you can get the full catalog there. You can check out the research archive there as well, or more directly at HoustonicITS.com. And you know the drill. Thank you for all the supporters on Patreon and PayPal for making this venture possible. We are, by the way, cruising in. We just have a few days left, I think. I don't know what technically is the first day. But I think we only have 1 or 2 more days left before it's been officially four full years completed. Sadly, 3.5 of them we're talking about cooties. But 4 full years. We are going into the 5th year of the program. Hello, watcher. How you doing? We are reading Yale Law Journal, February 2023 article called The Antibody Patent Paradox. It's good to see now. I've seen a variety of other programs suddenly take on talking about patents a lot lately. I've been negligent myself up until 1 or 2 months ago. I don't know exactly when it was. I turned that corner. I think it was when I started looking at the Weinsteins, trying to figure out why Brett and Eric Weinstein got to where they were. And then it became pretty clear that I was missing it. This article is, I'm sure there's plenty of other articles out there that we should be digging into as well. They all have a bend to them, right? They all have a particular position. They all have things they don't want to say. But long story short is the U.S. patent system is being fundamentally challenged and is being poised to being redeveloped, rebuilt. It's easy to think that this is a patent issues about different companies wanting to protect their money or get more money or whatever. And of course, individuals want to protect their money and get more money. But this is way beyond that. So you can view a lot of that through here. It's just a fascinating document. Again, I've probably mispronounced a few words from it. I apologize for my naivety there. But it is critical. And the fact that we have patent lawyers all over the place, from David Martin, who I put on this cover, this one, who in 2020, and I mentioned it this weekend, I'm sorry to have to do a little bit of commentary here before I get into the reading, but I think it's necessary. In 2020, I think it was September 7th, 2020, on the Virginia Real show, as I showed, David Martin made multiple references to patent issues that need to be addressed, and they need to be addressed within the antitrust division of the Department of Justice. It was a very, very specific phrase he kept saying. And I'm not really familiar with how all patent disputes get resolved, okay? But the phrase he used spoke directly to the Drug Industry Antitrust Act. It came out of United States Senator Estes Kefauver of Tennessee in 1962 under the JFK administration. And the first patent lawyer hired by the United States Department of Justice, the Antitrust Division, was Les Weinstein, father of Brett and Eric Weinstein. And here we are, 61 years later. What are we talking about? Talking about antitrust, we're talking about patents, we're talking about the DOJ, etc. And we have Brett and Eric Weinstein, and now this David Martin. I don't know David Martin's ancestry. Very difficult to figure out. It took me a few hours last night just to get his freaking birthday nailed down. But that said, at some point he went from a guy who was working in sports therapy, sports medicine at the University of Virginia. I think he had an injury at one of, he was in college at Goshen College or Goshen in Indiana. And he decided to, turn to get a doctorate in sports therapy, which is fantastic. But at some point, he made that transition in 1996, 1997. He transitioned to to a degree in radiology. That's fine. And then by 98, 99, he is a co-founder of this intellectual property company. That's a pretty freaking fast jump. So there's these patent lawyers all over the place. So something's in the air. You can smell it. And then I've been hesitant to get into the issue, but I realized the role of Les Weinstein, and then Les Weinstein being a key lawyer with respect to this Centocor Abbott Labs or Centocor Genentech case regarding patents on proteins in 2011, and antibodies are proteins. It was that led me to this document. Okay, it was Weinstein that led me to this document. This document was written, and then 3 months later, which is like some minimum waiting period, it's being sourced by the United States Supreme Court, along with a variety of other documents, I'm sure. This is hot stuff. This is really where it's at. Don't be deceived by some people wanting to make $1 billion here or whatever. That's noise. That's noise right now. That's nothing. This is a very, very big issue. And it's so big that this movement to usher in the new era of personalized medicine, to use the human population that's here now to observe and collect data, to be assessed as soon as possible or whenever it possibly can, to figure out how all of these pieces of our machinery work. Okay, that's kind of what this is leading to. How do you write patents for something you don't really understand? How do you write patents in a way it makes it sound like you know what you're talking about, but in reality, you're trying to cover up a bigger agenda? That's what's going on here. So I know I'm in a small camp, but it's a growing camp. I'm not saying that cancer-promoting genes are impossible. I'm just saying that I don't believe that the knowledge of the human machinery is known at that level yet. It's just not. And there needs to be many years of data collection and analysis to get to that point. So that's why we are reading this document and studying this document. Let's get into it. So we're still finishing up section 2, but the last part is what we're down to right now. We may start section 3. Okay, so antibody claims in the courts today. Very few, if any, functional antibody patents are going to survive Amgen's and Juno's revolutions on enablement and written description. Post-Amgen, the enablement standard for antibodies has become, if not an impossible barrier, at least an impractical one, especially for the myriad antibody claims issued before Amgen was decided. Because of the science of antibodies, any antibody claim centered on functional elements, even narrow ones, like those directed to a precise affinity or avidity, will likely encompass antibodies beyond those discovered in the specification. And if the Federal Circuit's math on antibody diversity is accurate, they will cover many undisclosed antibodies. It no longer seems to matter, as the Wands test suggests, whether identifying these other antibodies or even a representative subset of them would require undue experimentation. Rather, in the words of Judge Laurie, the standard now is, quote, not simply that the claimed genus was numerous, but whether it was so broad, extending far beyond the examples and guidance provided, unquote. Given what we now know about antibody science, no robust specification could possibly encompass all possible examples of functionally claimed antibodies. Though in other fields, enablement has long been satisfied by linking the scope of claims to instructions for their use. For antibodies post-Amgen, quote, one cannot claim everything that works, unquote. Things are even worse when it comes to written description. The written description requirement is now satisfied only if the specification enumerates, quote, representative species or common structural features to allow a person of ordinary skill in the art to distinguish between inventions that achieve the claimed function and those that do not, unquote. But again, the science of antibodies has made the legal standard impossible. Similar functions for antibodies do not mean similar structures. Antibodies are made, naturally at least, through semi-random rearrangement of the VDJ cassettes. They can be further selected for based on their function, that is, by the antigens to which they bind, but their utility and inventiveness is based on these functions, not their underlying structure. Put less abstractly, researchers have little interest in the particular DNA sequence that gives rise to a particular antibody. They are instead interested in what the antibody does and how it does it. So, although function can make an antibody representative by class, by establishing a group of molecules according to what they bind to and how, this class might have no common structural features. This representative structure standard is, if not scientifically impossible, textually impractical. Demanding it is roughly equivalent to demanding that a software patent identify individual strings of computer code that every implementation must have in common, even if slight variations do the exact same thing. That's a good phrase. One can see this future in a recently decided district court case, Baxalta, Baxalta. I'm assuming that's the right way, Baxalta Incorporated versus Genentech Incorporated. In Baxalta, Judge Dyke, D-Y-K, Judge Dyke, a federal circuit judge sitting by designation in the District of Delaware, determined that Baxalta's claims to specific antibodies, in which one arm of a CDR's Y-shape bind to one antigen and the other arm to another antigen, were invalid for lack of enablement. Baxalta's claims were indeed broad, including, for example, quote, an isolated antibody or antibody fragment thereof that binds factor IX or factor 9 or factor 9A and increases the procoagulant activity of factor 9A. But the specification of the asserted patent nonetheless provided much of the antibody's underlying DNA sequences and 11 working examples of antibodies that fell within the scope of the claims. Nonetheless, this combination of functional claims and structural disclosure was not enough to overcome the enablement hurdles set forth in Amgen. The claims, even in combination with the disclosed sequences, did not, quote, describe what structural, or other features of the disclosed antibodies caused them to bind to factor 9 or 9A, or to increase the procoagulant activity of factor 9A, unquote, even though the specification provided working examples. The issue, instead, was that, quote, potential candidates number in the millions, unquote, and routine experimentation is not the only way to practice the teachings of the patent, according to Judge Dyke. Quote, is by trial and error, i.e. screening tens of thousands, if not millions, of candidate antibodies to determine whether they satisfy the limitations of the asserted claims, unquote. This failed to satisfy the enablement standard, but given the breadth of antibody diversity, it is difficult to imagine antibody claims with functional limitations that do not suffer from similar deficiencies. While Judge Dyke did not address written description, it is difficult after Juno to imagine the patent satisfied the requirement. If the standard now requires the specification to demonstrate possession of every or almost every structural variation of the claimed invention, not merely its novel elements, then no functionally claimed antibody patent could withstand the challenge. In Baxalta, for example, Judge Dyke noted that the specification gave, quote, no specific direction as to the structure and, quote, no assurance that once any modifications are made, the antibody will retain the same functional qualities, much less that making it bispecific would enhance its properties, unquote. Such an assurance would be technically impossible, an empty promise for almost all functional antibody claims. In November of 2022, as this article was going to press, the Supreme Court granted certiorari, certiorari. I'm sure that's a court word. I apologize. Certiorari. I'm trying, guys. And Amgen on the enablement issue, while denying certiorari in Juno on the written description issue. The Amgen case, which represents the court's first foray into the law of enablement in over a century, offers it the chance to fix the problem the Federal Circuit has created with its full scope enablement doctrine. The fact that the court denied certiorari in Juno, however, means that the same full scope problems may arise in the written description context, regardless of how the court rules on enablement. Whew, boy. Boy, oh boy, oh boy. And behind it all, it's the variability. It's not just like, 20 antibodies and 20 antigens and, which one's going to work where. There's just, it's, as it says in the very first paragraph of this document, this narrator's note, it's galactic in scale. Galactic. So, if antibodies have that much variability, how could we possibly know that individual genes do very specific things, if only changed in a few cells? Okay, let's have a chink. So now we're going to start section 3. What's going on here? Section 3 out of the 4 big sections. Hey, TCG. Similar structures do not mean similar functions. I'm going to go having some good chats lately with TCG here. He says, similar structures do not mean similar functions. Similar structures do not mean similar functions, meaning a similar structure may do different things, either within different people or possibly even the same person in different situations. It's so when trying to patent antibodies that are going to be made a certain way for everyone, right? Maybe there's a couple different types. This is, how do you get there with this much variability? This also does a good job of backing up the big data aspects of a lot of this. Certiorari, a writ by which higher court reviews a decision of a lower court. Thank you, TC. Hey, Kim, how you doing? Deborah, good to see you. Good to see you. He has fessed to being former intelligence at some point in his presentation. Who? Who? Who confessed to being former intelligence? Yeah, it's okay to talk about other stuff here. Yeah, Peter Ross says, yep, regular chemicals follow structure function rules, but antibodies are full of surprises. Can't make broad claims on antibodies, which limits any patent on antibody-based invention. Yep. And so this whole world of personalized medicine is going to require, you could just see the collision. And this collision started 25 or so years ago, as this document has stated. And eventually we're going to read some of the histories of these monoclonal antibodies. And it's also confusing because there's a lot of names, a lot of companies, a lot of biotech companies that we've just kind of glossed over up until now. As I mentioned earlier, I never really... I made the mistake of thinking that the antibody companies were just some sort of low-hanging fruit and somewhat uninteresting. Reality, far more interesting than that. It might even be the reverse. We might even be pushing, or I should say the world, or the world of medicine, if you will, might be pushing the pedal down on genetic vaccines, not to save you, but to have new ways of having approved gene therapy to better understand how proteins, which include enzymes or proteins, etc., and everything else are expressed. So it's freaking amazing. All right, so let's get back here. To work here. So what's behind this rather dramatic shift in the law of antibody patenting? And is it truly specific to antibodies or part of a broader currents at work in the federal circuit? We can imagine at least 4 underlying narratives to explain this revolution in the federal circuit's jurisprudence. Each explanation has a certain amount of truth to it, but none of the 4 by itself is perfectly satisfying. Where's my mouse pointer? There we go. The first is to take at face value the court's assertion that when it comes to molecules, structure is king. Perhaps independent of the technical nuances of biology, patent law prefers claims covering atoms, that is, things, over, say, variable domains, which is a combination of a thing and what it does. A second explanation is that the court is concerned with the problems of functional claiming generally or specifically in the software context. Antibody patents have simply found themselves in the wrong place at the wrong time. A third possibility is that the court's changing jurisprudence reflects advances in the science of antibodies, as scientists have learned the extent of antibodies' complexity. The same Genus claims to a given antibody has, with hindsight, expanded, and the federal circuit is now restricting them in kind. A fourth explanation is that the federal circuit is simply responding to politics concerning the drug industry, doing what they can do within the confines of some particular narrow doctrines in patent law to curb patents that are responsible, in part, for exorbitantly expensive drugs. So this is section 3. What's going on here? Part A. So, of course, it's going to be A, B, C, and D. I think for the 4 types, the 4 explanations. So, section 3, part A. The primacy of structure. The simplest narrative for the Federal Circuit's restriction on antibody claims is that one let me restart this. The simplest narrative for the Federal Circuit's restriction on antibody claims is the one the court offers itself in the cases just discussed. Patent law is concerned with chemistry, and chemistry is all about molecular structure. Pithily, antibodies are molecules, and so they are chemistry, albeit chemistry on a scale large enough that atomic identity is impractical. On this theory, now that researchers can somewhat routinely identify the structure of a particular antibody, the only question relevant to a claim scope is whether other antibodies within a given claim share the same structure. If they do not, you cannot claim a genus of them. And even if some do, it is still the structural homology that matters, even if that structure isn't particularly connected to the function. So a defendant whose antibody structurally looks different shouldn't be infringing, and a patent that too broadly covers other variants shouldn't be valid. This explanation, simplistic though it is, has the virtue that it's what the Federal Circuit claims it's doing. It is also consistent with the law in other patent life sciences doctrines. Others have remarked on the Federal Circuit's obsession with structural identity in chemical and biotechnological cases, and the court has coupled that focus with the repeated incantation that chemistry and biotechnology are unpredictable arts, which, to the court at least, means we can't know what even small structural changes will do. For antibodies, the unpredictability of the connection between structure and function largely remains true, though that doesn't mean the science as a whole is unpredictable. That is so well said. I think, anyways. I'll reread that one. For antibodies, the unpredictability of the connection between structure and function largely remains true, though that doesn't mean the science as a whole is unpredictable. So the science, maybe the science is totally unpredictable. However, we don't know that. All we know is that there's a lot we don't know. There's a lot that is still unknown. And there may be so much variability that it's possible that in many cases it will never be able to predict all the different associations between structure and function. Perhaps it's so variable, okay, that it actually expands. I should say, there's actually perhaps more permutations than there ever will be people that live. Maybe. But a structural story cannot explain why the Federal Circuit allowed antibodies to be patented in purely functional terms in the first few decades of their existence. Perhaps the answer to this mystery is that the Federal Circuit has, in fact, become more obsessed with structure over time. Remember, they didn't know what the structure was initially. They didn't know. So the antibody patents of old started off without knowing the structure. Isn't that just fascinating? This sentence here, narrator's note. We have to, as we are studying this science from the historical perspective, please keep in mind that the state of the art, the state of knowledge, has changed significantly over the years. Papers that were written, let's say 50 or 80 years ago, on different observations about viruses and illness and what methods or what therapies worked and what didn't. The data within them is accurate I'm sure they didn't just make stuff up in the laboratory. However, there were limitations on what could be measured. There were limitations on the accuracy of the measurement. There were limitations on what could be seen. There were limitations on what could be filtered. There were limitations on what could be understood structurally. So while the data is presumably correct and has been peer-reviewed and so on, so much else has come in during those years. So much more has been learned. And so there have been more science built upon that. There were patents built upon what's then. But now, as we have more and more capabilities, that doesn't mean that what was seen back then was wrong. However, its understanding may have been, maybe that we could better describe what was happening back then. So you have to mate all of these things now. You have to mate the history with the current. And how do you do that? I'm going to read that again. That's just cool. This is cool. This is cool. This is where we're going to be scientists. We're going to be archaeologists. I should say archaeologists, archivists, researchers, history researchers, but also scientists. And now you can use this to understand some of the complexities of the patent issue. I'll restart this paragraph. But a structural story cannot explain why the Federal Circuit allowed antibodies to be patented in purely functional terms in the first few decades of their existence. Perhaps the answer to this mystery is that the Federal Circuit has, in fact, become more obsessed with the structure over time. Indeed, that obsession with structure in the chemical realm is one explanation for the growth of the written description doctrine generally. As noted above, the doctrine has useful purposes in preventing gun jumping and late claiming, but it has been applied more broadly in the life sciences as a sort of super enablement requirement. You know, this is going to be embarrassing. I have to make sure I'm pronouncing this word right. This is just a word that you don't typically use too often.
The Greeks, the Syrians, the Romans, the Scythians?
Genus. And
Genus.
the common genus I call reorganizational practice.
Genus, not genius. Genus.
And just in a line, the thing
became far more active. This beautiful example of an early member of the genus Homo was not a tentative.
In this study, a population...
So it's genus. I know it's not genius. It's not genus. It's genus. It's genus. Genus claim. Okay. Thank you. The result of this newfound obsession has been what one of the authors has called, quote, the death of the genus claim. The genus claim, unquote, in the pharmaceutical industry in recent years. That obsession, along with the idea that biotechnology is inherently unpredictable, has increasingly caused the court to allow patents only for individual species that are proven to work. This has permitted the Federal Circuit to reject genus claims, even where, as in Juno Therapeutics, the genus identified is, once disclosed, both well understood and predictably specific to a large class of antibodies. Simply put, if antibody claims written in functional form are, in some senses, the ultimate genus claims, a Federal Circuit intent on demise of such claims would render such antibody claims invalid under this recent doctrinal shift. On this theory, the Federal Circuit's U-turn on antibody claims isn't about antibodies in particular, but about chemical structure more generally. Antibody claims just happen to get swallowed up by the system's larger reaction. It would be particularly ironic if this were the explanation, though, because the evolving lesson of antibody science is that structure isn't everything. There are many paths to bind to an antigen, some of them quite structurally different from another. Limiting antibody patents to only a single molecule or even a representative one would narrow antibody claims, but not in any logical or meaningful way, nor in any way that parallels laboratory practice or biological significance. And by the way, and I mentioned this before, there's tons of footnotes in this 70-something page report written by Yale. You could probably spend a month, and in fact, I know of people who have spent a lot of time reviewing this document, and they just every day, just get more and more and more out of it. And there's just so much that just they didn't even know had been happening. So feel free. I just need the reason why I did an electronic copy is because I could have just downloaded the PDF. I do have the PDF, but I wanted to have a copy where I could insert hyperlinks, if you will, to the reference content, or if there is, let's say, a obscure company, it's like Centocor, that's undocumented mostly on, say, Wikipedia, I can have hyperlinks now to my own pages on Centocor incorporated, and I find that to be useful. So not looking to steal it, but they put it out there for a reason, right? And so that's why I do it this way. Okay, so section 2, part B. I'll probably do one more part here, and then maybe we'll call it a night. I just wanted to have one more episode this month and keep you guys up and keep things going. This is not an issue that's going to die. It's an issue that is, it's just so huge. And I'm not even really in a situation yet where I can fully explain it. All I know is, look, if you see patent lawyers all over the place, at a time when the whole world of medicine is changing, you just have to go, yeah, that's the metadata. It's like, okay, clearly. And remember, antibodies are just types of proteins. So many of the referenced rulings in here aren't even necessarily antibodies. It's protein expression. Even more generally speaking, what makes proteins? The ribosome. The ribosome they only recently finally had a full 3-dimensional, using X-rays crystallography map of the ribosome itself, which is made up 50,000 or 50 million atoms or something like that, something crazy. And each cell has up to 100,000 ribosomes. So there's a lot of machinery throughout your body. Okay, a rejection of functional claiming. Hopefully we can finish this little subsection here. A second explanation is that the demise of antibody patents reflects a broader rejection of functional claiming. Almost no antibody patents claim a specific chemical or even a series of steps for making a chemically defined antibody. Rather, most claim the effect of the antibody itself, binding to a given antigen. But antibody patents are not alone in defining their claims functionally. Software patent lawyers have been writing patent claims in broad functional terms for decades. Ta-da! The resulting functional software patents, many of which are outrageously overbroad, such as, I think, Amazon, some company actually patented one-click. The idea of you see something online and you have you can log into a website, right? And you can have your credit card and on file and your address. The whole concept of one click. You see it, you click it, winds up in your house. I don't know who patented that. I thought it was Amazon, maybe it was eBay, whatever. So what? So every time someone does that from that point forward, they have to pay a royalty. You know what I'm trying to say. So outrageously overbroad. Overlap. Let me restart this sentence here. The resulting functional software patents, many of which are outrageously overbroad, overlap and create patent thickets that have been widely identified as a significant problem in the software and information technology fields. The Federal Circuit might view antibody patents in this same vein today. Patent law has faced functional claims before. They were quite common in the early 20th century. The Wright brothers, for instance, notoriously claimed the idea of creating a warped wing aeroplane. However, it was to be implemented. That's wild. The Supreme Court ultimately rejected such broad functional claiming in the 1940s as inconsistent with the purposes of the patent statute. When Congress rewrote the Patent Act in 1952, it adopted a compromise position. Patentees could write their claim language in functional terms, but when they did so, the patent would cover not the goal itself, but only the particular means of implementing that goal described by the patentee and equivalents thereof. These, quote, means plus function, unquote, claims permitted the patentee to use functional language to describe an element of their invention, but did not permit them to own the function itself, regardless of how it was implemented. A second possible explanation, then, is that the Federal Circuit is simply bringing antibody claims in line with the general strictures of functional claiming. The court's en banc reaffirmation of the written description doctrine in Ariad, A-R-I-A-D, Pharmaceuticals Incorporated versus Eli Lilly and Company, has some of this flavor. The patentee in Ariad wrote its claim in functional terms, seeking to cover any later discovered drug that bound to an important inhibitory molecule in the inflammation pathway, NF-KB. The Federal Circuit rejected this attempt as, quote, a vague functional description and an invitation for further research that does not constitute written disclosure of a specific inhibitor, unquote. One could perhaps look at antibody claims and say something similar. But if this is the explanation, it presents a different irony than the one on structure. For many of the modern problems with functional claiming seem, let me restart that sentence here. It's really important, by the way, when you're reading something for the first time, that commas are in the right spots. Sometimes, at least this is for the most part a well technically written document, but there's a couple of times I wish the comma was in a spot where it wasn't. Then again, I've been mispronouncing words from it, so who am I to criticize? For many of the modern problems with functional claiming seem largely confined to the software realm. See? I have to read this again. Sorry. For many of the modern for many of the modern problems with functional claiming seem largely confined to the for many of the modern problems. I think it's missing a comma or something. For many of the modern problems with functional claiming seem largely confined to the software realm. I think this little off here is throwing me off here. I apologize. Most perniciously, functional claiming is frequently used by software patent trolls who, claiming the idea of solving a problem without ever having made a product, sue those who actually do solve the problem. To date, at least, most antibody cases don't present similar worries, both because antibody patentees have almost invariably discovered and made new antibodies, and because function can still be defined at a much lower level of abstraction. Even if claims directed to binding to a particular antigen are like, quote, rings with a million keys on them, unquote, that is still a significantly smaller subset than functional software claims, some of which are akin to claiming the very concept of unlocking or unlocking anything. Despite this, the Federal Circuit has done relatively little to rein in functional claiming in software, where it is generally overbroad, causing significant social harm, and employed by patentees who add little social value. Indeed, 2 Federal Circuit decisions that came down in the year 2022 essentially endorse pure functional claiming in software, undermining en banc circuit precedent established in Williamson versus Citrix Online, Citrix. That's an old processor company, LLC. But the court has been hypervigilant in preventing functional claiming for antibodies, extending this vigilance even past the point of novelty in Juno. One of us has argued with Dan Burke, B-U-R-K, that patent law is technology specific, allowing the law to adapt to different technologies and market conditions. The Federal Circuit periodically denies any such differences, even in the doctrines that most exhibit those differences. For example, antibodies and software. But by stepping in to restrict functional claiming, the Federal Circuit seems to be not only creating technology-specific patent law, but is arguably doing it in a way that is, quote, exactly backwards on, quote. All right, so we're going to stop there. Section 2, Part C would be next, the laws following changes in the science. For those who also are, I don't blog that much, but I do have a Substack. If you are interested, I do have it listed on the, if you just go to the main page, I have it right there. At least I thought I had it right there. Maybe I don't anymore. Maybe you have to go to the Houstonic ITS webpage here. HoustonicITS.com. I should put it also on the Houstonic.live, but I do have a Substack. I only have like 4 or 5 articles. Maybe I'll be writing a little bit more. I'm trying to find a balance of outlets to use to get traffic, and I also need them interlinked a little bit, right? The problem with, I find anyways, with blog posts is they tend to be one-off. It's sort of like PowerPoint slides for an individual presentation. Yeah, that's great, but how do you reuse them, right? Blog posts tend not to be subject specific, so I'll probably do one from every time to time when it's just something I need to call out or clarify, and it'll be linked to our research pages as well as our videos as we can. And I already have several hundred subscribers on there. The last one was a pretty spicy article I wrote. Amazing. Only 24 likes on it so far. Can Robert Malone help us identify the 2001 anthrax letter mailer? It's just houstonic.substack.com. With so many connections, nobody else is more qualified to know who the real bioterrorist was. And I wrote this on August 10th. So again, I I just decided to list out. I'm not suggesting anything. I'm just saying that he was in a good situation to know. Maybe he can help us finally resolve the crime that led us to these Department of Homeland Security and all these Bio-Patriot Acts. It would be nice to help us out. Also noteworthy that if Malone has been a government contractor or a government employee for as long as he said he has, he is not allowed, without permission anyways, to tell the truth about anything he worked on. You do realize that. He cannot tell the truth of what he has worked on. He can lie about it. If he tells the truth of what he has worked on, he needs to be arrested under the Espionage Act, the same one that Snowden is being pursued with. And what does this mean? It means as long as he's talking, he's not telling you state secrets. And that's pretty much true for all government whistleblowers. Remember, whistleblower doesn't mean someone telling the truth. Whistleblower is someone that's seeking protection to keep their job for complaining about something. It could be something as simple as their salary. Whistleblower does not mean truth teller. So, I never worked for the government. Doesn't mean I'm telling the truth, but I never worked for the government. There's no chains on me. I don't have any special insights to anything. I have public sources. That's what I have to work with. So keep that in mind as the leaders of 5G warfare and the hit list of the people who they say are actually working against them. Even that, you have to question it, right? Just a little bit, something I just needed to throw out there. So with that said, everyone, thank you very much. Take care. Great month. God bless. Another great month, September coming up. Just about wrapping up year 4. I'm looking forward to starting year 5 with you guys. Let's keep doing it together. God bless.